Is it the pleasure of the House that Bill number 10 be now read a second time? All those in favor of the motion will please say yea. Yea. All those opposed will please say nay. In my opinion, the yeas have it. I declare the motion carried.
An act to amend the Education Act.
Accordingly, the bill stand referred to the Committee of the Whole House. Is it the pleasure of the House that
private members' motions. Private members' motions, notice of motion, private members' motions, motion 10. Motion number 17. No, we're doing bills, we're doing motions now, so we're on motion 17.
Yeah.
So we just said private members' motions, motion 17. I recognize the...
we are on private motion now, and we'll be starting motion 17. Recognize the member for Carleton. No. Recognize the member for for Armagh to Lincoln. Sorry.
Just going to get a podium there, Mr. Speaker. Yes, please. Thank you very much, Mr. Speaker. I'll read the motion.
Yes.
On behalf of the member for Carleton York, I shall move the following resolution, seconded by the member for Fredericton Grand Lake. Whereas Lyme disease is a preventable disease, whereas Canadian Lyme Disease Foundation said the disease is vastly underreported in Canada, whereas Lyme disease can be debilitating and cause symptoms such as extreme fatigue, cardiac and nervous system disorders, and arthritic symptoms, which affects one's quality of life and ability to work. Whereas a conference on the federal framework on Lyme disease is being held in May of 2016 that will include provincial health ministers and other stakeholders. Whereas Lyme disease in New Brunswick often goes undiagnosed for many months or even years before treatment, whereas New Brunswickers have been traveling to the United States of America in order to receive diagnosis and treatment of Lyme disease, whereas New Brunswick needs better public education about Lyme disease symptoms and treatment, be it resolved that this Legislative Assembly urge the current government to work collaboratively with the federal government and other provinces and territories to better educate the public on the spread of Lyme disease and its symptoms. Be it further resolved that this Legislative Assembly requests the Department of Health also work collaboratively to find solutions to update public health information on prevention and detection of Lyme disease, protect health professionals who choose to treat Lyme disease beyond 30 days from suspension by the College of Physicians and Surgeons, recruit health professionals who specialize in the detection and treatment of Lyme disease, and implement improved professional development for health professionals in the awareness, prevention, treatment, and diagnosis of Lyme disease.
Okay. It has been moved by the member for Armagh to Lincoln, seconded by the member for Fredericton Grand Lake. Whereas Lyme disease is preventable disease, whereas the Canadian Lyme Disease Foundation said the disease is vastly underreported in Canada, whereas Lyme disease can be debilitating and cause symptoms such as extreme fatigue, cardiac and nervous system disorder, and arthritic system, which affects one's quality of life and ability to work. Whereas a conference on the federal framework on Lyme disease is being held in May of 2016 that will include provincial health ministers and other stakeholders. Whereas Lyme disease in New Brunswick often goes underdiagnosed for many months or even years before treatment. Whereas the New Brunswick has been traveling to the United States of America in order to receive diagnosis and treatment of Lyme disease. Whereas New Brunswick needs better public education about Lyme disease, system and treatment. Be it resolved that the Legislative Assembly urge the current government to work collaboratively with the federal government and other provinces and territories to better educate the public on spread of Lyme disease and its system. Be further resolved that the Legislative Assembly requests the Department of Health also work collaboratively to find solutions to update public health information on prevention and detection of Lyme disease, protect health professionals who choose to treat Lyme disease beyond 30 days from suspension by the College of Physicians and Surgeons, recruit health professionals who specialize in the detection and treatment of Lyme disease, and implement improved professional development for health professionals in the awareness, prevention, treatment, and diagnosis of Lyme disease. On the motion, I recognize the member for Armagh 2, Lincoln.
Thank you very much, Mr. Speaker. And on behalf of the member from Carleton York, it gives me great pleasure to lead the debate on the motion on Lyme disease. This follows up from a couple of years ago, a motion that this House unanimously supported, and we hope that this allows for an opportunity for bringing further awareness to the illness of Lyme disease that has progressed and is a continuing growing problem. And certainly four things I've identified to start off to list. The need for doctor and public education regarding symptoms, along with better treatment and diagnosis for Lyme disease. Addressing the health of patients in New Brunswick suffering from undiagnosed long-term Lyme disease and associated illnesses. There's a growing group of people that must be better served by our provincial medical system. Ongoing awareness to the public, including surveillance and monitoring of tick infection rates in our province, is essential. Participating as a province in developing a federal Lyme disease framework is essential in creating a venue to bring many stakeholders, patients, and the medical community together. Lyme disease is an inflammatory infection that spreads to humans through an infected tick attached to your skin, generally for more than 24 hours. Thank you. Ticks pick up the bacteria by biting infected animals and then pass it on to their human hosts. There are many strains of Borrelia that cause Lyme disease in humans, just as there are many strains of the flu virus that cause flu symptoms in humans, with some strains more damaging than others. As I mentioned, this is not a new issue to the legislature. It's not a new issue to our province, but it is a growing problem. The time has more than passed for more provincial leadership, more collaboration, and more coordination to the solutions that are ever ongoing and being needed for this population of patients that are affecting many people in our province. There are 3 stages of Lyme disease. Stage 1 is early infection, within the first few days after infection. Stage 2 is the infection spreads in the body, days to weeks following the infection. Stage 3 is the chronic, untreated, long-term chronic Lyme disease. Can be anywhere between days to weeks after the infection, if left untreated, or not properly treated for months and even years after the infection. Lyme disease is most treatable during stage 1. As time passes, both treatment and diagnosis become more difficult. There are characteristic symptoms that occur with various stages of infection. Many, but not all, develop a bullseye rash as the earliest symptom. Symptoms worsen during each stage of infection, ranging from flu-like symptoms to neurological illness, including paralysis. When untreated, long-term chronic Lyme disease, there is not one system of the body that can be unaffected. This includes various hormone production as well. Lyme disease seems to be on the rise in Canada. Lyme is an issue in New Brunswick and is certainly concentrated in a few key areas, particularly in central and southern New Brunswick. People with Lyme disease and other similar illnesses go undiagnosed for sometimes long periods of time. There is a lack of treatment in New Brunswick, and there is a need for more awareness in the medical community and public at large. Many of these people who are sick and unwell need our help. They need to know what is wrong with them. These people are in chronic pain, and their health is deteriorating. Some have been diagnosed and treated in the United States. There is a very active support group in Fredericton. Louise Billings, Debbie McCann, and others are continuing to coordinate a body of people to work together to help each other, to provide support, to provide information, to provide awareness, and also to advocate to government that more action needs to occur. This, as I said, is not a new issue. They've continued to advocate successive governments over 4 or 5 years in particular. And collectively, as individuals in this Legislative Assembly, we believe that more can be done and more must be done. This is an opportunity today to raise this issue as a chance to bring awareness, but also look to go to the next steps of bringing relief to these patients. These patients are crying for help, literally. Myself, the MLA for New Maryland-Sunbury, the MLA for Fredericton-Grand Lake, and others have attended these meetings. A wide variety of backgrounds of these patients with no voice. Husband, wives, children, even children who have come to know are children of deputy ministers and assistant deputy ministers, wives and spouses of the civil service that we know well, even relatives of the members of this Legislative Assembly. Testing and diagnosis. Untreated chronic Lyme disease patients can face a long, hard fight to wellness. Chronic undiagnosed Lyme can affect a number of systems and can have significant consequences to the heart and nervous system. People with chronic Lyme can have many debilitating symptoms, including severe fatigue, anxiety, headaches, and severe joint pain. Undiagnosed long-term chronic Lyme disease results in a huge and potential avoidable financial and services burden on the healthcare system. Several hundred tests, MRIs, X-rays, the appointments, all within New Brunswick to try to get service, treatment, diagnosis, and treatment. One individual showed us the list of his wife's appointments and tests of being over 200 and still undiagnosed in New Brunswick. The cost of the healthcare system, the cost to individuals, the cost of employment loss is enormous. Individuals that have no treatment and diagnosis are forced to leave their work, are forced to mortgage their houses, are forced to travel to the United States, putting in their cost for hotels, private costs for medication, private costs to cover testing that is unavailable in our province. Without proper treatment, chronic Lyme patients have a very poor quality of life. Lyme is a complex disease that can be highly difficult to diagnose. Having access to Lyme disease testing and proper reading of these tests can be very challenging. In fact, many patients receive several false negative tests before being correctly diagnosed. It is apparent that a proper diagnosis of chronic Lyme disease has been difficult for hundreds of New Brunswickers. While the statistics that we've seen and the government has seen and the officials see, very few are officially diagnosed with Lyme disease, there are many more hundreds that have found successful treatment in the United States after being diagnosed and treated for this illness. There's much disagreement, not only in New Brunswick, in Canada, and the United States, on the effectiveness of the standard ELISA test. Many recommend the need to allow for using the Western blot test on all suspected Lyme patients. Lack of definitive blood tests and the role of clinical diagnosis in both early and late stages of the disease are the subject of much debate. Existing diagnostic tests are debated as to their reliability. Some tests not yet available, which leaves many patients, including doctors, relying on immediate signs of Lyme disease, discovery of a tick on the skin, a bullseye rash, and possibly joint pain. However, the research indicates that many patients do not recall a tick bite, have not been able to report a rash, and joint swelling typically occurs in only 20 to 30% of patients. And also, given the prevalent use of over-the-counter anti-inflammatory medication such as ibuprofen, joint inflammation is often masked. Based on these statistics, a significant number of people who contract Lyme disease are misdiagnosed during the early stages. Add to that the lack of awareness of obvious symptoms leads to a chronic form of the disease which can prove even more difficult to diagnose and treat. Lyme disease is often referred to as the great imitator because it mimics other conditions, often causing patients to suffer a complicated maze of doctors in search of appropriate treatment. The Provincial Lyme Disease Support Group recommends that the diagnosis of Lyme disease and any of its co-infections based on a clinical assessment of symptoms by the family doctor be adopted and promoted in the New Brunswick medical community. As for treatment, research shows that when diagnosed early and properly with the proper treatment, Lyme disease treatment has a high rate of success. Early diagnosis and treatment is utmost importance. However, it can take several rounds of antibiotics to overcome late diagnosed long-term chronic Lyme infection. A doctor's ability to prescribe antibiotics for treating Lyme disease past 30 days can be restricted by the medical societies, usually as a result of fellow doctors making claims about the treatment practices of other doctors. While all along at the same time, patients feel they are on a merry-go-round of debate. The longer the diagnosis takes, the worse the patient gets, the longer it will take to treat, the more tests, the more appointments, and the more these lives and families suffer. And as a result, our province as a whole is suffering. The Provincial Lyme Support Group recommends the protection of doctors who choose to treat those suffering from long-term chronic Lyme disease that have no apparent choice but to travel to the United States for diagnosis and treatment. Diagnosis and treatment that could be available here in our province. Also, the National Lyme Disease Association recommends that the Canadian treatment guidelines be revised and updated immediately, including allowing open-ended treatment based on the judgment of the family doctor. A special chronic illness clinic of internal medicine specialists here in New Brunswick could work together to collaborate, coordinate, and help the undiagnosed patients. This could be a measure that would make a significant difference in the interim. As I mentioned, awareness, education of doctors and the public. Ongoing tick surveillance is important, as this disease may spread and rates in our ticks may increase over time. It is important that persons entering areas with high rates of positive ticks use precautions, wearing bright-colored clothes and doing tick checks after being outdoors, especially in kids. You know, one would be surprised at how many people are affected by this illness. The number of people affected are growing on a daily and weekly and monthly basis. It's amazing how when you go to a support group meeting, to see the people in the room and the people that we know, people in this room, in this Legislative Assembly, we know these people, we know these sons and daughters. And I was surprised to see the number of people that I knew, but I had no idea that they were suffering from Lyme disease. And as we know, that the first time I remember hearing about this illness was about 8 or 9 years ago with the deer population coming into St. John, into Rothsay, Quispam, Sis, and there was a concern about Lyme disease, and never really took the time much to hear too much about this. And then the most recent time before today was about 3-4 years ago. MLA Jack Carr from New Maryland Sunbury worked with Debbie McCann and the other Lyme disease people from the Lyme disease support groups in New Brunswick, and brought a motion here to the floor of the legislature that he and the MLA from Campbellton had supported, and was unanimously supported by the legislature, calling for a strategy, calling for diagnosis, calling for treatment, better treatment. And since this time, we have heard more and more about it, and more about the effects. And I'm able to share with you today the impact that I've seen of this illness on my own family. For 2 to 3 years, my brother-in-law was going undiagnosed with an illness. Of course, I was busy at the time in cabinet, probably while this whole motion was being debated, not having the time to really listen, but on the peripheral knowing that there's medical problems taking place. 4 young children under the age of 6. Can you believe it? I think that, I won't say anything more, but that would be a challenge in itself. Then dealing with a chronic health issue. Again, multiple appointments, testing, x-rays, going from one specialist to another specialist, all the while your health is deteriorating. And he is an individual at the time who had a contract position of employment, scared and nervous to tell his employer that he was battling this undiagnosed illness because of the fear of not getting renewed his contract. As I mentioned, having 4 young children, not sure whether they would continue with medical insurance, not sure whether he would even have a job, or whether he'd be well enough to be able to actually keep working. Fortunately, he was permanentized at the University of New Brunswick, and in addition to that, he has been in contact with the Lyme disease support group, and he also was able to get diagnosed and treated. Unfortunately, he, like many hundreds of others, got diagnosed and treated and is still under treatment from the United States. And so it's very, very frustrating to see those that, it's encouraging, I should say first, to see those that have been successful in reaching through the maze. People like Debbie McCann, who went to New York to get diagnosed and treated, and many others who have had success. But it's very frustrating to see people that maybe don't have the ability to go to the United States to pay out of their own pocket to the doctor's office and to buy their own medication, or to find a sponsoring doctor here in New Brunswick. So there's ongoing challenges. It's an ongoing need, and today is an opportunity to raise these issues again, as they have been raised in the past, and adding one more voice, one more person with awareness, one more member of government, one more person, an MLA, a civil servant, a medical professional, someone in the community, people that can work together to make a difference on this issue, so that these patients aren't stranded, so that we can ensure that they're getting Canadian diagnosis, Canadian New Brunswick treatment, and that every individual that has an issue with this illness or an associated illness can live full, productive lives here in our province. A national conference in Ottawa will be held next month as a result of a private member's bill passed in the House of Commons. This is being led by Public Health Canada. Consensus and collaboration in New Brunswick can be achieved by holding open and transparent discussions with the medical community and the public affected by this illness, using evidence and the full spectrum of peer-reviewed literature. Development of better testing and treatment with increased emphasis on patient outcome is required to resolve differences among various viewpoints. As I mentioned, this is not a new issue. This is a growing problem. The time has more than passed for provincial leadership. I admit I've not been involved with this issue much prior to 2 to 3 years ago. But there's time for everyone to get on board and to move forward. The more that are aware of this, the more that we see of the people that are affected, the more that these patients are crying out for help. Our hope today, as a result of the member from Carleton York, who introduced this motion, that the House will get an update from New Brunswick's involvement in the federal framework and the province's work on a Lyme disease strategy. I also hope that the provincial government and the Legislative Assembly can urge and encourage the New Brunswick stakeholders, patients, and New Brunswick medical community to work together in parallel with the federal Lyme disease framework to address this very important issue. Thank you, Mr. Speaker.